In this video, I'm going to be talking about some of the pharmacologic alternatives to Adderall. These are prescription medications that you might be considering as an alternative to Adderall. Maybe you failed on the medication. Maybe you're on the medication now, but you don't like how you act on it. Maybe it's causing too much appetite suppression, or you think it removes your personality, but you're looking for something to help you concentrate and focus without some of those side effects. We're going to be discussing a nice list here, a curated list of alternatives that I have both prescribed, some of which I have tried. I'm going to be giving you the short synopsis and personal experience with each one so that you can take this to your physician and make a good, educated choice. My name is Dr. Jay Feldman. I'm an osteopathic physician. Let's get into the video. Let's talk about some of these alternatives. And I'm really going to break them up into three different classes. Class 1, which you're probably familiar with, this is going to be the amphetamine-based medications such as Adderall. Class number 2 is the methylphenidates. A little bit different, a little bit older, believe it or not. Last but not least, we're going to talk about non-stimulant medications. Now, don't let the name fool you. These pack a powerful punch and can be a good alternative to the stimulants. Let's get going. Let's kick it off with the methylphenidate-based medication with one of the OGs, one of the medications that has been around the longest, and this one you have probably heard of before, and that is Ritalin. Now, a little bit about Ritalin. It's been around for a long time, which means it's relatively cheap. So if you're having trouble affording your medication, this might be a good alternative. Now, in my experience, I've seen this prescribed oftentimes to kids and oftentimes by older physicians. Not a lot of people use this anymore. Methylphenidate does have a stimulating effect. You are going to feel the wired jitteriness that you would on Adderall, but it's a little bit different than amphetamines. Now, Ritalin is methylphenidate. It comes in instant release. It's relatively affordable and something that you might want to consider switching to, but I would not really advise it. Granted, this is not medical advice. Please talk to your physician. Going further into the methylphenidate-based category, another one that you might have heard of is Concerta. This one is more commonly used with kids than Ritalin, in my experience. It is also methylphenidate-based, and it lasts generally about 12 hours. Again, more commonly used in kids. You're going to have a lot of the same side effects that you would on Adderall, some appetite suppression, some jitteriness, but it is a good option specifically for children. But it is something that you can try if you fail with the amphetamine-based medications. If you fail the amphetamine-based medications or do want to experiment, I would reach for the methylphenidates next. It's a slightly different chemical. It also definitely has effects on the dopamine and the epinephrine response in the brain, similar to Adderall, but just a slightly different side effect profile, and people respond a little bit differently to each. So definitely something to talk to your physician about trying. Now let's talk about some of the amphetamine-based medications. Adderall is in this class. Now, Adderall's distant cousin, which is Vyvanse, which you've probably heard of as well, is also amphetamine-based, only comes in long-acting, can be quite expensive. A lot of insurances won't cover it, and even if they do, it can be a little bit of money. Now, what's awesome about Vyvanse, the side effect profile is slightly better than with Adderall. You get a little bit less appetite suppression, you get a little less habit forming, and I think that's because the massive dopamine response is just a little bit smaller. So, great medication if you are having too intensive side effects with Adderall and are able to afford a little bit more of a premium brand name medication. Now, Vyvanse, their trademark is still active, so there is no generic version. That is why it is so expensive. So something to consider, but if you're having a problem with the side effects, not really the cost, Vyvanse is definitely something that you should consider trying. All right, now here's one that you probably haven't heard of before, and it's not one that I have ever seen actually prescribed. I actually only knew one person who was on it, and that is Excedrin. Excedrin actually contains dextroamphetamine, which is what Vyvanse is converted to in the body. So it's kind of like Vyvanse. Think about it similarly. This comes in instant and XR. The price is going to vary quite a bit. Definitely talk to your physician, talk to your insurance company, even talk to your local pharmacist. See what you might be paying for this. But this is definitely in the amphetamine class, right up there with Adderall. That might be an interesting thing for you to try if you can't quite afford Vyvanse, or maybe you want a Vyvanse-like side effect profile, but you want them instant release. Excedrin might be a good option for you. All right, let's discuss some of the non-stimulant medications that can be used for ADHD. Now, if you don't like the side effect profiles with the stimulants, if you're unable to take them, tolerate them, or have any kind of contraindications, these medications might be a good alternative for you. Now, you should know before I start listing these off, you may not have heard of them before. Some of them might be off-label use, and you're not going to get the same feeling, rush of dopamine that you are going to likely get on the amphetamines, that if you've already taken them kind of feels good. That rush of dopamine feels nice. The non-stimulant medications usually don't come with that, which also means that they have a much lower risk profile and abuse profile, which is a good thing. So let's start off with one of the newer medications, and that is atomoxetine, also known as Strattera. Now this medication, it's a non-stimulant ADHD medication. It works by increasing the levels of norepinephrine. It's a capsule. You take it once a day, no weight gain. And the weird thing about this medication that I've heard from talking to various patients and doctors is that sometimes you might get a little sleepy and tired after taking it. You may also have a hard time sleeping when you take it. So this is one of those things that might be worth it for you to try if you want to get off of the stimulants, you want to break your habit, you want to get rid of some of those nasty side effects that come with amphetamine use. This is something that you might consider trying. It's only really been around since like the early 2000s, since it was prescribed for ADHD and FDA approved. There's less long-term studies on this medication, but definitely a great alternative to talk to your physician about. The next non-stimulant medication I'd like to discuss, when you probably haven't heard of this, it's Guanfacine or Intuniv. Now, this medication belongs to the class of alpha-2 receptor agonists. Alpha-2 receptor is responsible for attention and behavior and impulse control. So this medication doesn't really upregulate a lot of neurotransmitters, which is good for abuse potential. It's good for being non-addictive, but it's not going to give you that same rush that you're going to get on amphetamines, which release a ton of epinephrine and dopamine. This medication works a little differently, and for that reason, it's actually used very frequently in cooperation and synergy with one of your other ADHD medications. Now, it can be used alone, but a lot of times it's used synergistically. Typically, it's taken in an extended release tablet once per day. It is going to be relatively affordable, so if price is an issue, this one will be fine for you. And if you're not quite getting the effect that you'd like on one of your stimulants, this is something that your physician might consider adding instead of just pumping up your dose of stimulants. This could be I don't want to say a healthier choice than pumping up the dose, but a good potential alternative that you can talk to your physician about. Some of the side effects of this one, unlike Adderall, which is going to make you alert and up, this one may cause you to be a little bit sleepy and drowsy. So make sure that if you're taking this alone, you keep that in mind. Finally, the last non-stimulant or atypical stimulant medication that I'd love to mention for you is Modafinil. Now, this is a medication that's been used for a long time for narcolepsy. It's been used in fighter pilots. And this medication is relatively strange in how it works. This is a medication that I actually use occasionally instead of amphetamines. I think this is a great way to stay awake, but not alert. So this is not going to release a ton of epinephrine and dopamine and give you that rushed, wired feeling like you're going to get on Vyvanse and Adderall. Instead, you're just going to be up. So I take Modafinil on nights where I get a terrible night's sleep, and I track my sleep every night using an Oura Ring and an 8-sleep mattress. So I know immediately if I wake up and I need to go to work or get something done, and I'm working on a very low fuel tank. This is a miracle medication that helps me get through that day at high efficiency. I take it probably every 2 weeks when I have a rough night's sleep. It is very non-habit forming. You don't get many side effects with this medication. Occasionally I'll get a little bit of nausea and a little bit of insomnia. It does not help you sleep, especially if you take it later during the day. This is something off-label, so it's not FDA approved for ADD. A lot of doctors will not prescribe this to you for ADD, so you need to find someone open-minded. You need to have an honest conversation, and if you try enough doctors or hire a concierge doctor, you will be able to get this medication. All right, guys, so those are some alternatives to Adderall that you might want to keep in mind, that you might want to consider and talk to your physician about. There's a lot of different reasons why you might not want to take Adderall or amphetamine salts, and one of these things might be the answer. Now, I will always steer you in the direction of do not rely on prescription medications for your day-to-day life. Instead, you can focus on taking some herbal supplements like a lion's mane or even a caffeine, and then work on your concentration. Your brain is a muscle, and if you meditate, that is going to the gym for your brain. And if you do it long enough, you train your brain to pay attention and focus without any additional help or dopamine release from these medications. However, I understand some people have ADD, and some people need these medications to get by, get through the day, and fulfill their dreams and be a high-functioning member of society. I, for one, used these medications when I was younger, and I have weaned myself off in older age, but I understand that you might be dependent on them. Take the steps to decrease that dependency, decrease your dosage, and eventually come off of them. Hope this video was helpful for you. If it was, and you love content about prescription medications, Adderall, ADHD, please hit the like button so that you can see more of me. Share this with somebody who's struggling with these medications, who's on these medications, who's considering putting their kids on them. They need to see this. They need to understand what's out there, some of the alternatives, and I hope you found this helpful. We'll see you in the next video. Thank you.